The role of private industry, public-private partnership. You're on the board of Facebook. I see Jim Breyer in the crowd here. How will private industry help, and how should they help? You've started a VC fund to address kind of market failures where entrepreneurs really have not, and venture capital has not filled in. Should tech be doing more, and do you think private industry could be doing more to help?
Here's the reason why we interact with private companies. We're a not-for-profit. And a lot of not-for-profits are a little timid about working with private industry. They have this thing about white hats and black hats. We have a thing about getting things done. And for me, I want to work with private industry because there's talent, money, pace, and power. And if you're going to try and solve polio or malaria or TB or HIV, you need all those assets. So for me, I want the assets that private industry has. But you talk about something like Ebola, Zika. Too often, the issues we tackle are market failures. And a market failure is when companies look at malaria, they say, we can't make money. We can't make money. We're not going to work on malaria or tuberculosis because there's no money to be had. So what we've done at the Gates Foundation is intense listening. Why don't you think you could make money when so many people are struggling with this issue? And so we've started to develop a number of tools. So a really good example of a very successful tool is a market volume guarantee. So we'll go to a company, and we're talking about big companies, Merck, Bayer, others. So with Bayer, we can use a volume guarantee so that we can get low-cost, modern contraception in the hands of the women who need it the most. And we can use our capital at the Gates Foundation to backstop that. Because we're placing a bet that you're going to sell a certain large number of items when they are effective and cost-effective for those countries. And we can then reuse that capital if our volume guarantee pays off and you actually do make those sales. We also use tiered pricing. We use equity investments or grants. So we have this toolkit of different tools that we use to work with companies so that they use their power in service of the poor. And the one thing all these things have in common is everything we do with private industry has a charitable intention. So we put a contract in place that ensures that the poor will be served. And this has been extremely successful, has brought new vaccines, new therapeutics, new diagnostics, new modern contraception to the people who need it the most.